My name is Pam McDonald, and I'm an integrative nurse practitioner, and I am the author of the ApoE Gene Diet. I'm a nurse practitioner, and I practice in a field called integrative medicine, which brings the best of allopathic medicine, which is traditional medicine, and alternative medicine. And the tool that I use is dietary to prevent mainly heart disease and chronic illness. I wrote the ApoE Gene Diet book because mainly I was frustrated with what I was finding in medicine as far as dietary guidance. And I discovered that, one diet does not fit all, and that there are differences. We are all different, and I think individual dietary guidance is important. And I think with the technology that we have today and the individual research and scientific studies that we're finding that the person is an individual and that we need to treat the dietary guidance as individual. When we look at the individual ApoE gene, we look at what that patient has and then match the diet and the exercise program for that individual genotype. The ApoE gene is basically a taxi for cholesterol and fat in the human body. It has multiple other important jobs, but what we do is we take a look at each different genotypes and we say, what is the diet that is required for each genotype? And then what is the disease process that the patient is being predisposed for within those genotypes? And we try to prevent it. When I really found out the power of the ApoE gene was in my patients. I had one particular patient come to me after being with her primary care for 16 years. Her cholesterol level ran around the low 500s. She had been on every drug. She had tried many diets and had been unsuccessful. She'd come into my clinic and we came to a decision that looking at the ApoE gene and doing diet was probably the next step. She agreed and we tested her. Her ApoE gene came back abnormal and we matched the correct diet for her. Within a very short period of time, her cholesterol came down to 201 from 500. That is a very powerful test and a very powerful intervention for any patient who wants to reduce their cholesterol. When we look at patients' individual ApoEs and we see their correct diet matched to them, our cholesterol levels and our clinical changes, how people feel, how the disease process stops, is huge. It amazes me as a provider how much change we can make in a person's health for the positive with giving the patient the right diet for their individual ApoE gene. Prior to this, when I would give a patient a general diet, I would not see this. You can give a patient, say, a low-fat diet, and I would not see the results. Because each individual ApoE gene requires a certain environment through a very specific type of diet for that individual ApoE. For example, the ApoE2 requires a little higher fat diet than, say, the normal 3-3 or the 4-4, which requires a low-fat diet. There are three major different types of ApoE, ApoE2, ApoE3, and ApoE4. The major type is seen in the population is ApoE3 in about 64% of the population. From those groups of ApoE, we as human beings inherit two combinations. Either we inherit a 2-2, a 2-3, a 3-3, a 4-2, a 4-3, or a 4-4 combination. We tend to see trends with groupings of these genotypes. In the 4, we see very high cholesterol, and we also see a connection between Alzheimer's disease and heart disease. When we're looking at the ApoE2, we tend to see some research that's connected to Parkinson's disease. We see also very, very high cholesterol and a particular type of high cholesterol called familial type 3 hyperlipidemia. The research is very clear with these. You give the patient the correct diet once again, and the patient's cholesterol or triglycerides go down and the disease process basically is turned off. When we're looking at the normal genotype, the ApoE33, clinically we see trends of diseases or disease states such as high blood pressure, insulin resistance, glucose intolerance, prediabetes, diabetes. This is something that I've observed much more in my patients with the 3-3 than I have in the other 2 or 4 groups. So with our general advice of low fat that we've been experiencing over the last 10 to 15 years, if you got your ApoE gene test and you were an ApoE2, for example, or a 3, then that would not be a good recommendation for you. It would put your body out of balance. And then you would be predisposed to disease process a lot quicker than if you ate the right diet for you. Clinically, for the ApoE gene diet, when I apply the right diet for the individual ApoE gene, I see some absolute amazing results. And for a provider who wants to get their patient better, I think as clinical medicine practitioners, we all really want to get the patient better and help them move on with their life. What I've found is that this is extremely rewarding because the patient walks in extremely sick and within a few months, well, within a few weeks, they're really feeling much better. And then they're on a journey not just from feeling better, but they're now living life to the fullest. And I think that is, without a doubt, magic. What I attempted to do by writing the ApoE Gene Diet book was to educate you a little bit about what is the ApoE gene, what's its importance within the body, how it affects disease process, mainly heart disease, Alzheimer's disease, chronic illness, and how to choose a provider to help support you make changes in your life. I then go ahead and give you some examples of how your diet is correct for you. I looked at individual genotypes and I've given you very specific diet plans. I've given you very individual recipes and tried to guide you step by step on how to put this process into place for you as you working with your primary care doctor.